Hi, I'm Bobbi Matchar. I'm director of the Duke Dementia Family Support Program. Our program provides education, support, and engagement for people living with dementia and their family care partners. And I'm honored to be here today with Anne-Marie Clifford, who's a caregiver extraordinaire who's going to share some of her wisdom about her mother. Anne-Marie, can you tell us a little bit about your mom, and then we'll sort of do some back and forth?
Absolutely. Thanks for having me. So I'm Anne-Marie Clifford, and I have been caring for my almost 77-year-old mother who 5 years ago was diagnosed with vascular dementia. And I'm so grateful that I was able to meet you and that I was able to join your support group that you offer through the Duke Dementia Support System. I'm part of the Daughters group, and I'm grateful for all of the wisdom that I've gained from the group, which I think we'll talk about a little bit later too. So thank you for having me today.
Well, I'm so happy you're here today. I'm going to start with talk about some steps to take after a dementia diagnosis. If you're listening to this session, chances are you have a loved one or somebody close to you who was recently diagnosed with dementia, and you may have left the doctor's office with a follow-up appointment in 6 months, or a prescription for Aricept, or perhaps a pamphlet, or maybe even the provider just said, take her home and just love her. But whatever information, however much or however little you left with, there's a good chance that most people leave that appointment feeling overwhelmed, not knowing where to turn. And while there's no one roadmap for figuring out what to do with dementia, I would like to talk about some steps that can be helpful for families. And Anne-Marie, I'll start with some steps, but please interject at any point along the way. The first thing I want to talk about is give yourself time to adjust. This news can be really, really shocking, and families feel a variety of emotions: sadness, anger, loneliness, frustration, a variety of feelings. Some people even have told me that they felt relieved when their parent or sibling or spouse was diagnosed, because now they had a name and a reason for behaviors that they'd been seeing for a while. Was that the case for you?
Absolutely. One of the things that I wrote down to share about today was the relief that I felt when my mom first got her diagnosis. Leading up to her diagnosis, we were arguing a lot. My father had recently passed away, and a lot of family members even were chalking this behavior up to grief. And I knew this was not normal grieving. So when we did finally get her to a neurologist and got the diagnosis, I was greatly relieved, because I started to feel like there was validation for my feelings. My mom did not believe her diagnosis, and that's, I'm sure we'll touch on that a little bit later, but I was greatly relieved to have, like you said, a name for it, and then be able to start formulating a plan of how we as a family were going to care for her.
Well, I'm glad you brought up the word grief, because I think that that's a really common emotion for families to experience after such a diagnosis, for caregivers to grieve the life that they have left behind and to grieve what they're going to miss down the road. So grief is a biggie. I also like to encourage families to educate themselves. Think about, learn about what to expect down the road, and be better prepared to handle the stages that will be coming ahead, and know what you can do. And educate yourselves at whatever pace works for you. Our program offers educational groups and webinars. You can go to our website, dukefamilysupport.org. The Alzheimer's Association is a great place to get information. Many caregivers like this book. I brought some props today. The 36-Hour Day. And this is its 7th edition. It's sometimes called the Bible of Caregiving. It covers everything from causes of dementia to what to do in the early stage to what to do in the later stages. You said that you picked this up early on.
I did. It was recommended through our support group. And the interesting thing was, I bought the book and I set it aside for a while. I was scared to read it. I was scared to know of what was in store for my mom and our family. And that's unusual for me. I usually attack things and educate myself the best I can, but this diagnosis was very overwhelming, very daunting, and I set it aside for a while. Once I read it, probably about 8 to 10 months into her diagnosis, I was grateful I read it because it did equip me with a lot of tools and knowledge to be able to start formulating a plan of how to successfully and lovingly care for her. So.
Well, I love that you reiterated the point that you need to educate yourself at your own pace. There's another resource I wanted to share, Caring for a Person with Alzheimer's Disease. And for people who aren't quite ready to take such a deep dive as the 36-hour day, this is a free book that you can either download from or order a paper copy of from the National Institute on Aging's website. And then there's another really, really important step, and that's thinking about legal, financial, and long-term care plans. Can you talk a little bit about what your family did?
Absolutely. Our situation's a little bit different because in my family I have my mom and my dad and my brother and me, and then my brother and I had a younger disabled sister who is lifetime disabled. So my parents initially had put a lot of the documentation in place for power of attorney and such surrounding the care for my sister. And then 2 years ago, my sister very unexpectedly passed away.
I'm sorry.
So it was a terrible thing, but also luckily when I called the lawyer after my sister had passed away to talk to him about further caring for my mother, who has dementia, he had told us that we already had all the documentation in place that we needed. And I know that that can be daunting for a lot of families to get that in place, to even get your parents to go to the lawyer, to even have these conversations about really relinquishing control is what I think a lot of parents see that as. And so I'm grateful that that piece was in place. I've had to have a lot of other conversations with my mom, but at least a lot of that power of attorney, healthcare power of attorney, all of those sorts of things, their wills, all of that was in place, and I was very grateful for that.
Yeah, you were lucky. Many families don't have their legal documents in order, and it's often really hard for caregivers to even want to take that step because it means acknowledging that your spouse, your sibling, your parent is going to get to a point in the future where they're going to need someone else to make their decisions for them. So that acknowledgement can be painful, but it's really important, as you know, to have the legal documents in order, and I encourage families to do that as early into the disease process as possible while the person with dementia has the capacity to make those decisions. I'm not an attorney, so I'm just going to run through the important documents that everyone have. One is healthcare power of attorney, financial power of attorney, a will, a living trust, a HIPAA document, and a living will, which is also an advance directive. Many families work with elder law attorneys. You can find an elder law attorney's name through the National Academy of Elder Law Attorneys. And many communities also have law clinics at law schools, and some regions have legal aid services that provide free care for seniors to prepare these sorts of documents. And again, start these discussions about legal documents with your person early. It's also important to have discussions early on in the disease trajectory about long-term care plans, what your person wishes in terms of home care versus care in a facility. While I'm talking about legal and financial issues, I do want to mention something that I've learned from other families, that it's really important early on to get your parents' or your spouse's passwords. You can't do anything if you don't know how to get into mom or dad's bank account, social security account, or email. So get those passwords while you can. And then a next step that I encourage families to take is disclosure. Disclosure simply means telling people about the diagnosis. I encourage people to start with those closest to them, family and friends, and people who need to know, like attorneys, doctors. And there are a number of important reasons to tell people that your loved one has dementia. One is for safety. Another is for public awareness. Another reason is that it opens the door to getting support. The sooner that you let people know that your loved one has dementia, the sooner that offers can start to come in, or you can reach out to people for help. And finally, families tell me that it's exhausting keeping secrets. Were you able to disclose your mom's diagnosis?
Yes, but it took a very long time, and it was multi-steps, like you said. My mom, when she first got her diagnosis, did not believe the diagnosis to be true. She blamed the doctors and said I had taken her to some very poor doctors who didn't know what they were talking about, which I've since learned is quite typical of people with having dementia. I started with the aunts and uncles in our family, and they were just shocked and not always supportive, saying, that, again, it was the grief of losing my father. But slowly I've had to open her circle a little bit more, especially to her neighbors, because there at times was some unusual behavior and they were concerned. And so I made sure to reach out to her neighbors to let them know what our family was going through.
Now, Anne Marie, you mentioned something that I was going to talk about later, your mother not believing the diagnosis. Sometimes it is that people deny the diagnosis. Sometimes they simply forget that their doctor has diagnosed them. But oftentimes it's something called anosognosia. That's a word I've learned a few years ago. And anosognosia means lack of self-awareness, lack of insight. Whenever I say that word, people ask how to spell it. So here you go. Anosognosia, lack of insight. An important word to keep in mind. Another thing to think about early on are safety issues. Safety at home and safety outside the home. And it's really a matter of balancing safety and autonomy. One of the big safety issues that I talk to families about has to do with driving. We're a culture that values driving. We value our independence. No one wants to give up their car keys. Did you have to have that conversation with your mom?
Well, unfortunately, my mother was in a car accident, and thank goodness she didn't hurt herself or anyone else. She hit a parked car. Surprisingly, after I had just brought her home from another errand, she determined she had to go back out and get something she forgot. Once the car was out of the picture, I just never got her another one. And we did actually take advantage of a program through Duke where we could bring Mom in to work with an occupational therapist for a driving evaluation. So I assured her that her doctors wanted her to do the driving evaluation first, and it was quite clear during the driving evaluation, I was in the room with her, that she could and should no longer be driving. To this day, she doesn't remember, right now, she doesn't remember totaling the car. She doesn't remember the driving evaluation, and she tells all her friends that her mean daughter won't let her drive. But I'm just grateful she's not driving, and that's the main thing. So, but I was always grateful I didn't actually have to take her keys. I was hiding keys to a secondary vehicle we had at the house for my sister to transport her, and I never left those keys at the house. I always kept them with me because I was afraid she might try to drive the handicap van. So,
well, I'm glad you got through that without anyone getting hurt.
Absolutely.
I would encourage families to consider a driving evaluation with an occupational therapist. I think of it as a gold standard of assessing driving fitness. I also brought another prop today. This is a book called At the Crossroads. It's published by the Hartford Insurance Company, and it can be downloaded online or a paper copy can be ordered for free. What I like about it is it has some sort of conversation starters, some ways to help families get the conversation going. It also has a great list of warning signs to look for that your loved one's driving abilities may be changing. There are also safety issues in the home. I don't know if you did this, but many families ask their doctors to make a referral to a home health agency for a home safety evaluation. You did that?
We did that, yes, we did. And we have safety equipment put in the bathroom, couple of safety rails around the house and those sorts of things. And then we have a lift chair furniture-wise to just help mom get up and down and things like that. So
great. So you added some safety features. The other piece of making a home safe for someone to live in with dementia is to remove hazards. You know, I think of things like throw rugs, all the electric cords I'm looking at here, which would not be good for someone with dementia. So you can add safety features and you can remove hazards. The Alzheimer's Association website has a great list of tips. They also have a room-by-room checklist of safety features for families trying to make homes safer for their loved one. In terms of safety, another concern is wandering. Is that ever a problem for your mom?
it hasn't been yet, but she does have 24/7 live-in care, and we do have outdoor cameras surrounding the whole house, so I get alerts when there's movement outside of her house. So we've taken measures to work to be proactive to try to catch if any of that were to happen. So she's no longer living alone and hasn't been for over a year now. So
great. Well, you may know that 6 out of 10 people with dementia do wander, and at least once. Many people wander more than once, and that can be really scary. Excuse me. I encourage families early on to provide some form of identification for their loved one. A good starting point is this little wristband that I was wearing. It's called Road ID, and it's not stigmatizing, and families can decide what sort of critical information they want to have on their person. So this is wearable ID. There are more sophisticated, high-tech versions. There are GPS bracelets, Project Lifesaver, available in many states through sheriff departments, has GPS trackers often available for free. Medical Alert has a monitoring system where you pay for membership. There are wearable devices that different families use. And then I want to end with talking about support. Support is so important, finding support for yourself as a caregiver. And that can look like something as simple as having friends or family to talk to regularly. I'm a huge fan of support groups. Support groups can be a place where you know you're not alone and get immediate practical information. Some people tell me that it was really scary going to support group for the first time. Hearing people whose loved one is further along than they are can be frightening. It may take a while to find the right support group, but I encourage people to consider a support group. And also, some people find that they need more than that, and they want to work one-on-one with a therapist for additional support. Anne-Marie, can you share with us a little bit about how you found support and what has worked for you?
Absolutely. So the first team that actually diagnosed my mom with her dementia is not the medical team that we are still with. So after my mom's initial diagnosis, I ended up taking her to a geriatric psychiatrist through Duke to try to help us with some of the anxiety issues that she was experiencing. And the geriatric psychiatrist at Duke told me about the Daughters group and told me that she thought it would be very helpful. So that's the support group that Bobbi runs for daughters like myself who are caregiving for their families or their parents. And that was scary to come to the first time. It was before the pandemic. I've been a member of the group for a while, so we used to meet in person. Now we meet virtually, but I'm incredibly grateful for it. And you're right, it was very scary hearing the other women share their journeys. I was at the beginning of the journey with my mom, but hearing what was to come, and with the disease of dementia, it's not going away. What you hear these other women, family members talking about is going to probably be in your future. So it can be very daunting. But I would say one of the besides the support group, the biggest element of support with us was once we got tapped in through Duke, and they have a group of folks who work on the geriatric and the dementia team. Those doctors that I was finally able to get my mom in with, they not only support my mom as the patient, but they support me as a family member. And that has been crucial to understanding that you're not only supporting the patient, but as a doctor or physician, you want to help the family members understand how to best help their family member on this journey. So I'm very grateful for the doctors and the care that we're receiving.
That's wonderful. We only have a few minutes left, and I know there's so much more to talk about, but I was hoping in the last few minutes you might be willing to share some other tips as an experienced and wise caregiver.
Well, absolutely. You make me sound, some days are hard and some days are better than others. I would just say to caregivers, give yourself a lot of grace. There are going to be really hard days, and then there are going to be okay days. I would also say one of the biggest things that I've learned for myself is I'm not going to be able to change my mom's behavior. I'm not going to be able to change how she reacts to things or what she says. I have to change myself. And through the support group, I also do have a one-on-one therapist for myself. It's been a time of growth for me because how I interact with my mom is very much on me now. And it has been very challenging as she's further along in her journey now, much more childlike. We hold hands when we go places. I buckle her into the car. There's a lot of repeating of questions, and yet some days it's really hard. I'm having a bad day. I'm frustrated or whatever, and it's challenging sometimes. But I think if you can realize that through education, through support for yourself, through giving yourself some grace, this is a very, very hard journey to walk with your parent. I think that you can come out on the other side of it. Things that I do for my mom right now sometimes are not for her. I threw a Mother's Day luncheon on her porch for her and 3 of her best friends. My mother doesn't remember it, even though it was just a few weeks ago, but I will cherish the photos and those memories forever. And it's more about right now for me appreciating moments that I have with her and being grateful for the occasional time where she'll say, I love you so much. I'm thankful for this time together. Filing that away and remembering that in the face of the really hard times that we've had or are even yet to come really do help me. So.
Well, I must say you just brought up all of the points that I was going to make, but you said it so much more beautifully than I would have, and I really, really appreciate that you shared what you did share today. So thank you so much for being with me today.
Thank you for having me.
And for all you do.
Thank you for having me, and thank you for the support groups that you run. Sometimes I hope you realize how invaluable the work that you do is to all of the different support group family members that you help. We're grateful.
Thanks, Anne Marie. Thanks for having us here today. Thanks for listening, everyone.